So let's begin. Before any massage or any procedure you want to have in your skin, be so a mask or a treatment, you need to remove your makeup. If you're wearing mascara, just maybe foundation, just taking a cleanser and wash it all off won't really help. It needs to be a makeup remover. Now, I suggest that you also actually insist that you also have a makeup remover specifically designed for the under eye area, because our under eye area is very delicate and we need different kind of products for this area. Now, it's usually said on the bottle that it's an eye makeup remover. Also, a good tip is that an eye makeup remover will be really suitable for the entire face. You don't have to spend money for two products. When you're wearing a makeup on your eyes, I would suggest you take 2 cotton balls. I love using cotton pads, like gauze pads. I like them better because they're very thin and they do not soak up a lot of the product. So I'm actually saving the product this way. So you soak them up real well with a makeup remover, and if you're wearing mascara, you put it first. That's how you start makeup removing process. So you put them on your eyes and you wait, say like good 20-30 seconds. We need to dissolve that mascara, not just rub it off with all the eyelashes. Now you remove the makeup on your eyes, and then you could flip it and you continue removing makeup from the face and neck area. Now, makeup remover as well as the toner is the product that goes. Don't save up on it. It's essential to remove makeup from your face real well. Once we're done with makeup removal, you follow with the cleanser. Now, the cleanser is a very important topic because the cleanser is supposed to be for your skin type or for your problem. Say if you have sensitive skin, you need to make sure that this product is suitable for sensitive skin. If you have oily skin, make sure you have a cleanser for the oily skin. But the oily skin is a different topic entirely, because if you just buy yourself a Clearasil, which is a harsh cleanser, you can't use it twice a day. Your second cleanser should be the one for normal skin. So this way you have one strong, so to say, cleanser and the other one mild, because acne prone skin is not supposed to be dehydrated, scrubbed off, or any harsh treatment is welcome on the acne prone skin, because it will only make the problems worse. The way you're using the cleanser, make sure it's suitable for your skin type, or at least for all skin types, and you use it again on the entire face. But if you have the cleanser that has tea tree oil or any harsh ingredients, or even BHA or AHA acids, you cannot use it on your under eye area. You need a separate cleanser for that purpose, something again for just the under eye area, but it's really rare to find those. Something for sensitive skin we will discuss further in the eye skincare. I will explain what cleanser is supposed to be there. Now, once you're done with the cleanser, if you're doing the massage in the morning, you can skip the cleanser. The next step will be a toner. If you don't use a toner right now, stop everything, stop watching the scores, go and get yourself a toner. I love even having several toners, because a toner is also the product that goes, and you could use it for your body as well. I love the trick when you can use a moisturizing toner on your hands before applying a cream, and any product you're going to use will be more effective if you use the toner. Besides, toner will restore your natural skin pH level and will also help to completely remove any impurities or again makeup, or even the cleanser that maybe hasn't been washed off your face. Now, it would be good to use a toner for your skin concern. Let's say if you have dry skin or is dehydrated, you use the moisturizing toner, right? If you can also use a calming toner, a vitamin toner, anti-aging toner, and on a daily basis, say if you have acne or if you have a combi skin like I do, I usually have 2 types of toners. So one I would use during the day would be mattifying or clarifying, balancing toner, and I would use it on the T-zone area, and I would use something anti-aging or vitamin, or even just hydrating toner on the cheek area and the neck and décolletage. So because very often people with combi skin, they have a problem when they try to dry out the T-zone area, but the cheeks are normal there, and they just become really dehydrated, so you can't do that. Sometimes you can even use a BHA or AHA toner, BHA in this case, which is salicylic acid. If you want to use it on the pimple, you could just use it directly on the pimple. Just put it there for 30 seconds. It will reduce the redness, inflammation, and you do not have to dry out other skin, especially if your skin is already inflamed and it's dehydrated. Do not forget your neck and décolletage area. These are also zones that will age with time. You want to prevent that, so give it, again, some extra love and attention. A note on hydrosols. Hydrosols are not really toners. I'm not saying it's a bad product, but I would recommend using them for younger people with younger skin with no real concerns. Now, finally, we shall need something that we will work on during the massage. That could be a serum or a cream. The serum would be in my case because I have a combination skin and I normally don't just use a cream, just like at all, at least if it's a mattifying cream, something with salicylic acid or lotion, but these types of products will not be good for a massage. We need the gliding motions to be smooth. Something that works for reducing sebum on our face will not be suitable for a massage. So I will give you some of the products that I like. In my case, I would love to use serums or gels. There are also creams specifically designed for facial massage. We will talk about that as well. And now this will mean that our face is prepped. So we removed makeup, we washed our face with a cleanser for our skin type, then we used the toner for our concern, and then we found the product that we will work on. Once this is done, we need to make sure our hands are clean because we're going to work with our hands. You may even use surgical gloves if you prefer. If not, just really wash your hands well. You don't need to rub them with alcohol and anything. So, but make sure it's clean. So the same massage preparation protocol will go for all massaging techniques, and we are mastering the first one, the basic massage right now. You can perform this massage daily and do different zones. Do, say, one day, one zone. Or you may do a course. You could do 10 procedures of all zones, 10 days. Then you have a break of 10-15 days, and then you can repeat the course. Or again, you just want to work on your forehead area, so today you do that. Tomorrow you work on the under eye area, and so on and so forth. So I hope you understand everything with the preparation protocol because it's important, and this information actually goes for pretty much your skin preparation before bedtime, instead of the serum or cream for the massage, you will apply the products that you want to use, be so a serum, cream, or a treatment.